Hello, and thank you for tuning in to Answers from the Lab, where we share Mayo Clinic knowledge and advancements on the state of testing and science from laboratory leaders and the people who are making it happen behind the scenes. I'm Dr. Bobbi Pritt, Interim Chair of the Department of Laboratory Medicine and Pathology at Mayo Clinic in Rochester, Minnesota. Hi, Belle. Welcome back to another great
It's good to be back. Yes. Summer is upon us.
Yes, and I think you've been traveling, I've been traveling, and I've been seeing a lot of people on airplanes wearing masks. And I think there's probably a good reason for that. If you turn on the news, you're hearing about respiratory virus cases on the rise. Be good to touch base on that.
For sure. Although my most recent travel was this weekend to northern Minnesota, where they've had a lot of flooding, unfortunately. So hearts go out to people there. But also, the grass is super long, and I was thinking of your ABCs and covering myself because there's got to be lots of ticks out there. So, not to mention a ton of mosquitoes are horrible. So let's move to respiratory viruses because they're at least a little more, at least they don't buzz in your ear, I guess, over mosquitoes or grab on your skin.
Yeah. Well, that's a good point. You usually think in summertime of things like vector-borne diseases, ticks, and mosquitoes, and maybe people aren't thinking of respiratory virus diseases. But we've been seeing a couple things in the news. One of them is that COVID cases are starting to go up a little bit. They're still relatively low, but I checked the CDC web page statistics, and compared to last week, cases are up a little bit. Emergency department visits are up by almost 15% for COVID compared to the prior week. Hospitalizations are up 25%, and deaths are up 16.7%. Now, these are mostly in people that have risks for respiratory virus infections for more severe outcomes. So I think it's a good idea for people to just consider their risk, that COVID is still out there. And we actually have these new variants that are driving some of this. And you'll like this, Bill. They have this kind of fun name. You've probably heard FLiRT variants. That it's named based on changes that have happened to the spike protein. And of course, that's the part of the virus that binds to host cells. And these particular variants, their mutations could increase the virus's ability to infect cells and evade the immune system, even if people have been vaccinated or have had the virus before. So there is a concern, and we're clearly seeing a little uptick in cases. I think it's good to remind everyone to take those precautions if they're concerned.
Yeah, FLiRT variant sounds so. Yeah. It doesn't. Yeah, but the reality is you won't feel real flirty if you catch it, and I think it's really important because I just talked to my parents who now live in a group home type of a setting, and it's think about this because people are visiting family, visiting loved ones. As you were talking, I thought back to all the sorts of common sense things that we shared when people were really concerned about COVID transmission. And those things should still apply if you're not feeling well. The reality is that between COVID, we know there's lots of human transmission, I should say. So being mindful of that, kind of thinking about those best practices. If you're visiting people, you've mentioned traveling with masks, people are doing that again. So it's these things are still with us. And of course, the numbers thankfully are much lower, but they're creeping up again. So we have to think about that. But what's really been getting a lot of press still is the avian influenza. So maybe we should just talk a little bit about that too, because I know that continues to be news.
Let's talk about that as well. CDC has been very vocal about it and has really done a good job to try to be prepared, reflecting back on lessons learned from the COVID pandemic and trying to think about how public health, as well as laboratories, academic, private health, community laboratories across the country can be better prepared. So I think the main takeaways at this point for avian influenza, the H5 virus, the risk is still low to the public, but future mutations, probably at least 2 mutations, could result in more human-to-human transmission, which we're not seeing right now. Thankfully, humans that are getting infected from exposure to infected cows or infected birds. But if we know influenza likes to mutate, and as an RNA virus, that's a given anyway, then there is that risk, especially when you have a large number of mammalian hosts like cows being infected.
Yeah, it's interesting because the CDC is being more proactive now in response to lessons learned from the pandemic. I know they've reached out to help assist private, public laboratories, I should say, not in the public health system, but just hospital labs and others, reference labs have testing available. I don't know the specifics. I can never remember the specifics, but you should visit the website. And of course, we've heard this from the CDC leadership earlier this year before H5 was in kind of, I don't want to say a concern because I don't, but it's something we were watching. So I think the CDC is being proactive. It raises questions in people's minds sometimes about, especially on the heels of COVID, is this too much? Are we talking about this too much? There's only been a few people have been sick, etc. That being said, it's actually something that's been around for a long time. I mean, public health laboratories, the CDC, it's the role of these organizations to be, watching for things that could impact human health and helping us be prepared for it. So we're probably hearing a bit more about it now because of COVID, but it's not being alarmist. It's really just actually the CDC and the public health labs and public health agencies doing what they're meant to do and trying to help keep us safe and making us aware, as I see it.
Yeah, and I think it's something that we should all be thinking about as laboratory directors, laboratory leaders is, what do they say? An ounce of prevention is worth a pound of cure. In this case, it's not necessarily prevention, but preparedness.
Yes.
What would our plans be if there was another outbreak of a widespread respiratory virus infection? What do we have in terms of access to testing?
Yep.
So at this point, I think the important thing to know is that laboratories have PCR-based tests for influenza. Some of them will type to H3 or H1, but a lot of times they won't give out an actual type. They'll just detect as influenza A. And so the question is going to be, if there was an outbreak, is how would we even know it was an H5N1? And I think that's the next step, is getting laboratories prepared to deal with a pandemic strain if that were to happen.
That's right. Yeah, I think it's really about tracking. And the good news here, there's a lot of differences between this and COVID. I mean, the good news is that the influenza test will detect it. To your point, it just won't subtype it. So from a public health kind of forensics perspective, will we really, it's important to know if we start to see human transmission, because it would be meaningful. The other thing is that, there are vaccines, a lot of things that didn't exist for COVID because it was entirely new to humans, do exist in terms of treatments, in terms of vaccines. And so we're much better prepared, but it's just that, but we still need to know if it really is if we start to see human transmission, because that's when we have to start thinking about using some of the tools that we have in the toolbox. So that's all the talk and all the discussion. The reality is no one wants to be sick in the summer. No one likes the summertime cold. So, just use good judgment, in terms of hand hygiene, being, hopefully people, there's lots of ways to visit people without be remotely or working from remotely. So using those things and just being mindful if you're not feeling well, preventing transmission. Because even look, I mean, COVID is on the rise again. Just other respiratory viruses can get people really sick. So it's good that we're watching for H5 and avian influenza. It's been a really devastating in the agricultural industry. I mean, lots of poultry have been put down because of this. So it's been a real problem already, and hopefully it won't be in humans, but it's good that we're watching.
Yeah, we'll keep an eye out and keep everyone updated.
That's right.
Well, thanks, Phil, for a great discussion as always.
That sounds good. Who knows what we'll have next? I'm sure there's plenty for us to talk about.
Oh, absolutely.
Till next time.
Till next time. Thank you so much for tuning in to Answers from the Lab. Be sure to subscribe to this podcast, and don't forget to tune in every Thursday and every other Tuesday.